Welcome back to Cancer Buzz. I'm your host, Summer Johnson, and I'm here live from the ACCC 42nd National Oncology Conference this year in Denver. This year's theme is Unleashing Innovation, and the future of cancer care was on full display during the ACCC President's Fireside Chat, Designing Oncology Care to Meet the Needs of a Growing Patient Population. ACCC President Dr. Una Hopkins led an inspiring conversation with leaders from 3 diverse ACCC member programs who are all using technology to transform their care models and address a growing patient population. These programs offer not just ideas, but real-world solutions that are in practice right now.
I am joined by 3 extraordinary leaders who are not just responding to the challenges ahead, but reshaping the future of cancer care. They represent 3 diverse ACCC member programs who each offer not just ideas, but real-world solutions that are in practice right now.
During the Fireside Chat, Director of Nursing Operations Karla Bowen at Orlando Health Cancer Institute discussed their AI-driven scheduling tool based in their electronic health record.
At its core, it's an electronic health record-based AI template management tool. For us, we used it, yes, for infusion. That's where we began. So it considers pharmacy compression time. So as an example, you have all your patients in at 8, you're doing your labs, your pharmacy is then compressed at 10. You have to mitigate that, right? Because then now everybody's running behind. It also takes into consideration the different locations available to a patient, what other services that the patient may need at that time, pre-treat clearances, lymphedema, wraps, nutrition, transport. We provide transportation for our patients. And it provides the schedulers the most appropriate location and time for the patient.
Their results are an incredible capacity boost.
So when we did that and turned it on, within 2 weeks, it found 100 hours over our 6 sites, time back to us without changing our footprint at all.
And it's dramatically cut the time patients wait to receive care.
One of the innovators referenced dollars and cents. So we did have from our super C-suite some push towards dollars and cents. Plus we had the data where we had more patients that were waiting too long for care. At that point, we'd done a lot of process improvement on our own, and we thought we were doing killer by getting the patients in within 7 days. Now we get patients in within 24 to 48 hours.
And for providers, the system has been a welcome change.
Any provider pushback?
Not at all. For us, the providers, honestly, we find med staff pretty much are like, do I need to do anything? You're like, no. Do I need to sign anything? No. I can see more patients? You sure can. Do I have to stay later? No.
NOC attendees also heard from Brian Lasonde, Advanced Practice Clinician Manager for Medical Specialties at Sutter Health.
By using those technologies over the last year, we've been able to create a system where we can make educational videos instantaneously over and over again and show them to the patients. It took us a while to get there, but what we're looking at is a lot of time saved for our staff.
He shared how AI and digital tools have served as a workforce multiplier. AI-generated videos handle the information delivery, making the in-person time more valuable.
I can see 3 patients in that 90 minutes that originally was just dedicated to one patient. Now I can have a video do it, and the patient could come in and ask questions, say like, hey, I watched the video, tell me more about this, and then I can see more patients in that amount of time.
Lasonde said they're meeting patients where they're at.
Our patients are getting the information on YouTube, TikTok. Like, they're going to video resources. That's what they want. So we have to meet patients where they are now with the technology that exists. And I think there's a way to do it, and hopefully our methodology can be used other places too.
And it helps the staff correct misinformation.
We can't control what patients see at home, and nor should we. I think that's not our job, is to police people and the information they get. But we have to basically meet misinformation with good information. There's lots of misinformation out there, and it's a battle and we need to start fighting it. And I think we have the tools to start doing it now.
Finally, Hopkins spoke with Dr. Charles Shelton, radiation oncologist and medical director at Outer Banks Health. He detailed for attendees how his center's program expanded access to high-quality care through a collaborative, prospective model of virtual cancer conferences or peer-to-peer discussions with urban and academic partners. Shelton shared the dramatic data.
Within about 5 years, we went from a 20% rate of having to change the care pathways to about 10%. Currently, we're at 1%. We've been doing this model for 11 years now, and we're only changing prospectively 1% of our plans. So that is basically showing how a model of collaboration between a rural facility or several rural facilities and an urban counterpart, which is academic, can vastly change the quality of what we're delivering.
This virtual collaboration is a powerful force multiplier for a resource-challenged environment, allowing a single rural physician to tap into a network of specialized expertise.
I spend 250 hours a year. I get 3,000 hours of collective expertise from people that are smarter than me, more wise than me. It's a game changer for rural America.
In the Fireside chat, attendees were able to engage, ask questions, and learn directly from these cancer centers. That's the focus of NOC, allowing an opportunity to learn and replicate innovative solutions. Here's Hopkins again.
And that's the beauty of ACCC.
Yeah.
We have all of these resources that we support and bring to cancer programs, no matter where they are. So you talked about meeting the patient where they are. We meet cancer programs where they are. We're not just in academia and we're not just in the community. We're everywhere. We're everybody's cancer program for both education and advocacy.
The message from the ACCC President's Fireside chat here at NOC is one of innovation and hope, harnessing fast-evolving technology to build capacity and ensure high-quality, patient-centered care for everyone. If you'd like to read more about the Fireside chat, you can check out the ACCC Buzz blog. We'll have a link right to it in the show notes. That's it for this edition of Cancer Buzz. We'll be right back here later today from the ACCC 42nd National Oncology Conference.